Hi, I'm Joanne Conroy, President and CEO of Dartmouth Health, and welcome to Connect with the CEO. Today, I'm pleased to be joined by Dr. Robert Brady, who is Director of our Anxiety Disorders Service here at Dartmouth Health. Today, we are going to talk about depression and anxiety, especially those episodes that people experience during this time of year when it gets darker earlier and we enter into the colder months of winter. And it is often called the holiday blues. However, before we start talking about that, I want to introduce Robert and have him tell us a little bit about himself, because our viewers do like to know people that I interview.
Sure.
So how long have you been at Dartmouth Health? Where did you come from? And how did you get interested in seasonal affective disorders, depression and anxiety?
Yeah, well, it's great to be with you, Joanne. I appreciate the opportunity to meet and have a conversation. So I did my training at the University of Arkansas in Fayetteville, Arkansas, and that's where I earned my PhD, my doctorate in clinical psychology. I then went on to do additional training at the University of Arkansas for Medical Sciences and a postdoctoral fellowship in the VA, and I've been here at Dartmouth Health for about 8 years now. Mm-hmm. And in terms of kind of how I got interested in this field, to be honest, it's a little bit of that kind of you study what you experience. So it's always fun to be in these kind of environments because it reminds me of my own kind of social anxiety. As a kid, I was so nervous it was hard to even go up to, I remember being at a Pizza Hut and trying to go ask for napkins. And I got anxious, I couldn't do it. And one of the things I've learned over time is to really face your fears. So every time I do a public event, such as this, it's another opportunity to learn safety in my own experience from doing these things and finding most of the time they go just fine.
Mm-hmm. That's really great advice for our viewers. One question about the difference between Arkansas and New Hampshire, because I noticed when I travel up and down the East Coast, you don't appreciate how far west some aspects of the coastline are until you actually travel and notice the difference between sunrise and sunset. So are seasonal affective disorders more common in New England than they would be in Arkansas, or are they just different?
Well, it's a good question. It's a research question. There was a number of studies that actually suggested there was a difference in latitude, that the farther up you go, at least in the northern hemisphere, the more likely you were to see patterns, at least, of seasonal affective disorder. But more recent studies that were more rigorous, used better criteria for that disorder, for that problem, have suggested that maybe there's not such a strong latitude effect, a location effect of seasonal affective disorder. And that calls into question a lot of the other research as well.
So then gets to the question, is it really sunlight, or is it the kind of temperature changes in the year? Is it, the change in how we do our work or live our lives? What does your field actually discuss in that realm?
Right. Well, and so this is the question that when people ask it, I think sometimes they're disappointed. The short answer is we don't quite know. But as with so much in psychiatry and in mental health in general, the answer is it's multifaceted. There's a lot of causes. There's a lot of correlations, meaning there's a lot of things that co-occur, go together, but they may not be causal. So certainly there is a suggestion and a hypothesis that the exposure to light, the numbers of hours of natural sunlight, might have an effect on circadian rhythms, and that can have downstream effects on activity levels and mood and all those sorts of things. The other thing you said, though, about what we do, how we spend our days, that's a common linkage across all of the potential explanations about why is there this seasonal pattern. And it's worth noting, seasonal affective disorder is really major depressive disorder with seasonal pattern. And so one of the kind of competing hypotheses is it may have a lot to do with how we spend our days, how we spend our time across the year, and how that might be determined by hours of sunlight and the seasons.
Probably also triggering because of the holidays and the stress during the holidays. Not only preparing, but our activity in the fall just seems to be very different from our activity in the summer. So they call this the holiday blues. What is the kind of belief of your field in holiday blues? Is it how much of it is seasonal affective disorder, which may be impacted by the sunlight and how we live our lives, and how much these triggering incidents, which many people have around the holidays, especially if they have stressful family relationships, the thought of getting together with their families and Thanksgiving and Christmas, which come, and Hanukkah and Kwanzaa and all the major holidays, they come right on top of each other. How much of that has to do with anxiety and depression during this season?
Well, I think it has a lot to do with our expectations for some of those events, especially when it comes to anxiety. So, as I was saying before, I love anxiety. It is a emotion that gets a bad rap because most people don't want to have it. Some people really enjoy it, but most people don't want to experience that. The problem with the role of those events is the expectation and how that affects the anxiety. So I always think about my own experience and those of others around me who say I get kind of anxious at the idea of having some of these events and trying to make sure they're perfect, trying to make sure they go off without a hitch. So what you've done is you've set yourself up for trying to seek perfection where it can't be found, or trying to avoid calamity. But the truth is, there are very few Griswold family Christmases out there. And
I think they had a few calamities.
They had a lot of calamities. You learn, where's the Tylenol?
Yeah.
But the truth is, most of the time, those sorts of events don't happen. And when people say, well, I'm so worried about this, that, or the other thing when it comes to these sorts of events, I ask them, which of these sorts of calamities do you recall? And if you actually thought back, which times did it really go so awful that it ruined the entire holiday? I can't think of any of those in my time. The truth is, again, most people have more things to think about, ponder, reflect on than the one time that the turkey was a little overcooked. And moreover, most people are looking back on those times and thinking about the togetherness that they had with other people, not the thing that wasn't just exactly so.
Yeah, well, that's actually good advice. And I think we've all had calamities in Christmas, and not just the turkey being overdone. I'm sure our audiences can think of many non-Griswold family Christmases.
Right.
I can't tell you how many sinks I've unplugged with potato peels in them that people don't understand that that's the fastest way to plug up a disposal is peeling your potatoes into the sink as you're trying to do dinner for 12. So let's talk about depression and anxiety then. My late husband had significant depression and anxiety, and it's much more common than people like to admit. And I think we've appreciated during COVID that it's a little bit worse. And how do you differentiate between somebody that comes into your office and with what they think is seasonal affective disorder, but you've probably identified they may have an underlying anxiety, depression disorder? And how is your approach a little bit different?
Yeah, sure. So I think it's helpful to kind of frame this, going back to kind of what is seasonal affective disorder? How do we think about it? It is major depressive disorder with a seasonal pattern. So more than the holiday blues, and really consistent with what we think of as a depressive episode. In terms of the numbers, so over the course of lifetime, we call that lifetime prevalence. Over the course of the lifetime, about 5% of individuals will meet criteria for major depressive disorder with seasonal pattern. Now you compare that to about 20%. Really, that's a big number. That's 1 in 5. 1 in 5 folks will have major depressive disorder with, regardless of the seasonal affect. So going back to that idea of 5%, sometimes I say 5% and people say, well, that doesn't sound so bad. But when you think about 5% of our entire U.S. population, that's a lot of people who are having a particularly tough time during this time of year, during the onset of fall and throughout the winter. In terms of how we differentiate it, we actually don't necessarily need to treat it all that differently. We can talk about light boxes and the role of that. But one of the key interventions that we use for depression is called behavioral activation. It's easily found on the internet. It's really useful. It has a high impact. And what we do with behavioral activation is we help a person to, first of all, notice patterns in their behavior in its relation to their mood. We then ask them, what are the values that you have? What's really important? What are the activities that bring you a sense of purpose, meaning, as well as enjoyment? And then we plot out a way to stay engaged in those or increase engagement in them. And there's a really powerful and fairly quick effect on mood. Now, it gets complicated, though, during the seasonal change because the very things that bring so many people so much joy and importance, they kind of shift during the winter. Mm-hmm. Now, I said before, I'm actually I'm a Southerner. I don't know if you can tell. Sometimes my local friends remind me of this, right?
I was going to say Arkansas.
Yeah,
yes, it's
right.
a different climate than New Hampshire.
And so I remember when we first came up here, when we moved up here in around September, that first winter was so great. We were blown away. My wife and I were playing in the snow like kids. It was so much fun. And then that second winter came along, and I remember thinking, you're telling me this is going to happen every single year? And so we had to actually, I remember that second winter, I was kind of bogged down. I wasn't doing the things I usually enjoyed. And it took realization that my behavior had changed as a result of the changing of the seasons and what I could do. Mm-hmm. I just had to adapt it. I had to find new things. I tried snowshoeing. I learned that you can, in fact, run in the snow. Trying to stay physically active and engaging in those fun and important things regardless of the season. Those are some of the ways that we address seasonal affective disorder. And the other thing I would say about this is it is not a hopeless problem. Mm-hmm. And in fact, seasonal onset depression gives you an advantage that other depression doesn't necessarily. It is essentially a forecast. It lets you know what's ahead. So it's like a weather forecast. I say it's, at least in New England, it's mostly cloudy and cold with a chance of depression, right? Mm-hmm. So you can actually plan ahead knowing that this is going to happen and set yourself up for a behavioral activation plan that fits the time.
You know, that's interesting when you talk about the statistics of depression and then seasonal affective disorder and depression. So the incidence of depression writ large is actually much greater across the population. And I think, you know, sometimes we ignore that. And when you have a seasonal affective disorder, it may actually just be a kind of a warning sign mm-hmm. that somebody needs to determine whether or not you actually do have constant depression, anxiety that just gets worse, and then get you appropriately treated. Mm-hmm. How often do you have to go to medication versus kind of behavioral therapy?
So, and there's some similarity across the kind of the emotional disorders, both the anxiety and the mood disorders. So medication has, for most patients, has a fairly quick effect. Mm-hmm. The downside is if you end the medication, the effect doesn't tend to have a lot of durability.
Correct.
Versus psychosocial interventions, psychotherapy, cognitive behavioral therapy in particular, has maybe a longer ramp-up time until it's effective. But what you're really doing is you're learning a skill, you're learning a technique, and there's more durability in that long term. The end result is they're largely equally effective, and it's really up to patient choice, person's decision. We know that has a significant impact on the long-term outcomes and the benefits of the intervention, whichever one it is, that it's the patient's choice and the patient has a say in what they're receiving.
Probably helps with compliance and consistency of utilization. And yeah, you know, it's interesting when I look at the winter, and I know a lot of people here say, oh, the winter's long, and you can tell I'm a cup half full person because I say, well, there's holiday mayhem in November and December. And then you have January and February. And then in March, you start to see the beginning of spring, even though we can have snow until April. So mm-hmm. my attitude is they're just really 2 months of deep, dark winter. Mm-hmm. And then we're on the upslope. But that's probably my own version of behavioral cognitive therapy.
Well, it's actually not so far off because just like I was saying before, it gives you a little bit of a warning sign. You also know that mood, that depressive episode is likely to decrease. In fact, that's one of the criteria for the seasonal pattern, is that there's this reliable alleviation of the depressive symptoms at the end of the winter season with the emergence of spring. And so, that's one thing that I actually will tell people to keep in mind is this is the tough time of the year. Yeah. The rest of it's a little bit easier, and we want to keep that in mind as we're going into that higher risk of a depressive episode.
Talk a little bit about loneliness and depression in the pandemic, because I mean, that's a major story across the country. Number one, not having enough behavioral health support for individuals, but it feels like, even though I think airline rage and road rage get a lot of headlines, I think it's just the increasing demand for behavioral health support across every single age group across the country. What have you seen here in the Upper Valley during the pandemic? Because you've kind of been pre-pandemic and all through the pandemic.
Right. So, well, I guess it's two things. There is very much a layering effect. So the pandemic is unique because it hits everybody. It affected everybody. Not in the same ways for every person, but everyone was affected in some way. One of the ways that it affects everybody is it did require a change in what we did and how often we did it, the ways that we did things. So just like we were saying before, if there's a decrease, if there's an upset in your usual patterns of behavior, when that occurs, when you have less to do or you don't have access to the same things that you used to.
People don't get to go out to dinner.
Right.
Yeah.
The things that we really enjoyed doing, now we're missing those. We have that sense of loss, of course, with that. And there's an increase in depressed mood as a result. Now you layer on that the seasonal change, and you're likely to see a further exacerbation, further increase in the rates of depression, particularly among those individuals that are most vulnerable to that.
Yeah. I do want to remind the viewers that if you have any questions, please comment on the video. We've got somebody that's actually collecting all the comments, and we have a list of questions at the end. We talked about the techniques that people can use to kind of manage depression and anxiety during the holiday season. I love the setting an expectation as the holiday parties with your families are not supposed to be perfect.
Right.
And that's actually probably the joy of spending time with your families. You can then talk about all the mayhem that happened afterwards and in years to come. But when you're with your family, sometimes you observe people in a different setting. And are there signs that we should be watching out for in our family members that, when you spend a week or 3 days with somebody over the holidays, you may see a change in their behavior that may indicate not only a seasonal affective disorder, but actually depression. And what should people look for? And then what would you suggest that they do?
Yeah. So one of the keys, it follows a theme here, is withdrawal. And now withdrawal can happen in a couple of ways. And by withdrawal, I mean decreasing engagement with others and decreased engagement with those activities that are so important. So if you see someone who says, who normally you would expect to say, I'm willing to do this, and all of a sudden they're saying, no, you're not seeing them very much, it's a good friend, and they're less available constantly, that might be a sign that you at least should check in on them, ask them how they're feeling, what are they up to, what are they doing to kind of keep themselves busy, to make a life. That's one form of withdrawal. That's pretty obvious. Another one is actually substance use increase. So that's another way of avoiding. We talk about substances as a way, drugs, as a way to kind of numb the experience.
Yeah.
So someone who's increased their alcohol use or other drugs, even some medications that they're being prescribed. So being mindful and observant of that, and asking them kind of how they're feeling about that sort of thing. What's going on? I notice that you're drinking a bit more than usual. Is everything okay? Just cluing in and saying something doesn't feel right. Something seems different for this person this time. It may be nothing, but at least you asked.
Yeah, that's actually a really good point. I can even think of just my last Thanksgiving, a niece that was between jobs was much less connected than she normally had been, and was listening to her iPods all the time and was not as engaged in the conversation. I didn't even think to ask her how she was doing.
Yeah, and also you know these folks, and when you know they're undergoing stressors, and talk about that idea of layering, this increased load of stressors, holidays, change in life that may be co-occurring, change in the seasons that's changing their access to those activities, all of those things together kind of gets my antenna up a little bit to be paying them attention and asking simply, how you doing?
Yeah. We forget how powerful that is, especially a family member. So,
right.
Yeah. We do have a number of questions from our viewers. One is about the light boxes.
Yeah.
Are they really helpful? And maybe what's the science behind it?
Well, so the data seem to suggest that light boxes have an effect, that they are, one fairly recent study said that the effect was not different from cognitive behavioral therapy. That doesn't necessarily mean that they were equally effective. It means in that study they didn't detect a difference. What they did show is that the effects of cognitive behavioral therapy in that particular study were more durable, that over the course of a couple of years, the effects seemed to be consistent. There may have been a little bit of a decrease in the effectiveness over time, but that long term it was still effective. Light boxes, again, were effective. The difference was that over time they seemed to be less effective. Another kind of caveat for the light boxes is there's so many that are available, and not all of them are equally effective. It has to do basically with the intensity of them, very importantly, the consistency of use. So the usual kind of dose of the light is 30 minutes a day. That means you got to sit there for 30 minutes a day and have the light kind of on you. And that can be hard for people to be consistent with. So all that said, I'm not saying don't get a light box. Certainly, if it works for you, it's not a huge investment over time. It's worth giving a try, and there is evidence that there is some effect, even if it's not completely understood why it's so effective.
Yeah, I was wondering about the science behind that. I mean, we used to talk about it in terms of kind of creating artificial sunlight. It's like we're African violet. We kind of needed that.
Right.
But what is the science behind it? Is it diurnal changes? Is it release some chemical, or we just don't know?
Right. So one of the hypotheses is related to its effect on circadian rhythms, basically your natural sleep-wake cycle, and the production of melatonin. That if there is basically less light and there's kind of an overproduction of melatonin, and there's a decreased kind of ability to have wakefulness during the day, almost a hibernation type effect has been compared to that when there is less sunlight, we tend to kind of turn down our intensity of every part of our life. Yep. There's more carb eating. There's oftentimes a weight gain that goes along with that, increased appetite, and accordingly kind of sounds like a hibernation state. And I'll say again, when you're hibernating, you're doing less, right?
Yeah. Yeah, just like our daily activities go down in the winter. And
Exactly.
you have to think about how to amp those up.
Yeah.
Another question. What is Dartmouth Health doing for employees suffering from SAD? Are there guidelines available that other employers can adopt to best support their team?
So I actually don't know the answer to that one.
I don't either.
Yeah. Now, I was thinking about our conversation in advance, and that was something that came to mind is, obviously with employee benefits and employers caring about the well-being of their employees, healthy employees are productive employees, and healthy employees are what we want because we care about people. Certainly employers could have ways of promoting access to outdoor activities. I know that some area businesses do kind of ski passes or discounts on some of those winter sport ideas, maybe family outings. Certainly trying to encourage people to remain active and engaged in their life during the winter months is pretty essential.
Yeah. We probably need to start with education and then figure out what the incidence is. But
exactly.
My expectation is it's probably more than 5% in our employee population because of so many people that work at night.
Right.
And I've got to believe some of our people that work nights and weekends their life is really disrupted.
Yeah.
By
well,
their work.
and healthcare is a stressful profession. So if you go back to the idea of layering, you're kind of stacking all of these things together, and the stress of the workplace is tough too.
Yeah. So another question, what can you do for a family member who's withdrawing and you're seeing they're having a hard time and you ask them, are they okay?
Yeah.
And they say they're fine, but you're still not convinced.
That's always a tough one, because if someone says I'm fine, pressing them more probably isn't going to get them to finally confess, right? We're not trying to get people to confess to being depressed, but letting them know that you remain available. They say, well, I'm fine now, and you say, well, if that isn't always the case, just let me know. I'm a phone call away. I'm a couple streets away. Whatever the case may be, we're a community here in the Upper Valley, unlike I think anywhere else, because we're all so close and we know so many people. It's like a big area. With ironically a lot of people, even though we're in this rural setting, and we're all still somehow really close by and seem to know each other quite well. So letting people know just because today feels great, if tomorrow doesn't, I'm still just as available.
Yeah, that's actually really important. You're right. We are a close-knit community. Like I like to say, we solve world problems in aisle 3 of the co-op,
Right.
where you see people. But it is still important to ask everybody, not just your family member, or, are things okay?
Yeah.
And authentically,
Yes.
not
right.
inauthentically. So, got another question about the power of breath and meditation to help with how we feel. What's the research around that?
Yeah. So there's the mindfulness and meditation aspects of psychosocial interventions is huge right now. I think most people are aware of many people at least are aware of that. There's so much research going into it. I think of mindfulness, and I like simple language to talk about some of these otherwise complex concepts. I think about mindfulness and meditation as a practice of being aware of what's going on in your mind, noticing what's actually happening. There's also a role of accepting it when you notice it. So you were talking about how to deal with depression, and particularly sadness that comes along with loss and reminders of loss during the holidays. I encourage people to accept the experience that you're having right then. It can be as simple as saying out loud, or in your mind if it doesn't seem like the right time to do it out loud, I'm having sadness right now. Knowing that this is a temporary feeling, and that the worst thing you can do is try to get rid of it, try to avoid it, try to not have that emotion authentically in the moment. Instead, just say, I'm having this right now. And that's where mindfulness and meditation comes in. It is a practice of simply being aware of what's going on internally. Helps you also be very aware of the role of your thoughts. If you have that thought, this holiday is going to be awful, it's going to be no good, and everyone's going to have an awful time. If you're not aware of that, guess what you do? You start getting more anxious, start getting more depressed about future events, because it's a thought unexamined. It's a thought that you're not aware of. I want people to be aware of their thoughts and then make a more conscious decision about how they engage with that thought in the long run.
Great advice. Asking friends about how they're feeling is tough because we worry it will push that person deeper into depression. Is that a myth, or should folks approach a depressed person with caution?
Is that a myth? That if I ask the
If
person,
you ask them, they become more depressed.
Yeah, I would say that's a myth. Not asking about how someone's doing, that's the problem. We have a society where we're not willing to talk about emotions sometimes, and we want to change. I want to change that. I want people to be more willing to talk about those, knowing that there's no stigma in feeling down.
Yeah.
If the data are accurate, it's 1 in 5 people will have meet criteria for major depressive disorder at some point. That's a lot of folks.
Yeah.
We need to get rid of the idea that this is something wrong with you, that there's something wrong that you have done, and this is uncommon. This is fairly common. 20% is a fairly common common occurrence. So no, I would encourage people to ask about that. Sometimes you don't get a second chance.
Yeah, that's great advice. I want to thank you, Robert. Really, this has been a great conversation. I want to thank all of our viewers. And there will be other information on our website, links to this and other stories around seasonal affective disorder. And I want to thank all of you for taking the time to call in. Thank you.